So the treatment of these ultra-rare disorders has actually come a very long way. Back in the 50s and 60s, we used plasma, cryoprecipitate, but now I think we should be really proud of the fact that we have single factor concentrates, which are highly purified, that are available for most of these ultra-rare disorders, except for factor V deficiency and factor XI deficiency in the United States. And so I think it's really an exciting time because you really have the availability of appropriate treatments. The difficulty is, I think, of providers availing themselves of the knowledge about these factor concentrates, especially since they're so rare, and making themselves familiar with these factor products and how to use them and in what context. The other issue is, I think, it's not currently clear to us, is the role of prophylaxis, that is preventative use of these factor concentrates in order to prevent bleeding. I would say there's at least a couple of disorders, for example, factor XIII deficiency, where I think we automatically do recommend prophylaxis, because factor XIII deficiency, severe factor XIII deficiency, actually can increase your risk for intracranial bleeds, which could be devastating in any individual. And so, for 13, I think that's what we do. For severe, for example, fibrinogen deficiencies, especially in a pregnant woman, replacement factor concentrate is also recommended. But with the other factor deficiencies, I think the jury is out there as to where you would really institute prophylaxis. Now, for example, if an individual has had repeated joint bleeds, say, then it's probably, one of the strategies that you would use if you've had 2 or more joint bleeds, again, extrapolating from the hemophilia world, that you would start prophylaxis in these ultra-rare patients. But for others, I think we are still trying to figure out what the best, way to do this. Implement these treatment strategies is. Yeah.